guys, my name is Maryam and I'm the manager at Improve Life PLLC. I'm going to be starting a new series on TikTok where I basically talk about different mental health topics, whether it's come up in conversations with patients, our interns, or if I just see something on social media that's trending or in the comments. The topic I wanted to talk about today is managing your mental health during school. I know school is starting back up, high school, college, professional schools, graduate programs, whatever. Regardless, keeping your mental health in check is the most important thing, and it took me months to years to realize that while I was in school. Save this video and I promise you, I am saving you months and months and months of trying to figure it out. So the first thing I would do is get a mental health evaluation. Just like you get your yearly physical, you need to get your yearly mental health physical. You need to please get checked. Dr. Weigel has a video on this, but basically just because something seems normal does not mean you have to keep dealing with it. So let's say you just get anxious when you're taking a test, right? You get test anxiety. Just because you know it's common to get test anxiety does not mean that you should just learn to deal with it. Anything that is affecting you during school or your everyday life should be managed, whether it's with medication or therapy. Don't just brush it under the rug. So how would you do that, right? I have different options for you. The first one, use your school resources. For example, when I was at VCU, I ran it up. If I'm gonna pay all these fees, I'm gonna use all the doctors you guys have. Use your free school clinic. They can refer you to their school psychiatrist, which is also probably free or discounted. So use the resources that they have, free therapy, like use those resources. If you have insurance, call your insurance, give them your zip code, they'll give you a list of providers. I will say though, that a lot of insurance providers have a wait list right now of 3 to 6 months, which is awful, I know. We need more mental health providers, but what psychiatrists are starting to do now is go out of pocket or out of network, or they won't even accept insurance at all. So if they don't accept insurance, people think, oh, like I'm losing money, like I'd rather use insurance. But don't think insurance is your only way to get healthcare. You can get something called a super bill that has the codes that insurance uses to give you money or pay for your visit. So the same way, you pay for your visit beforehand, which I think is the only con, but you can get reimbursed. I've seen people get 50%, 75%, all of it. It really depends on your insurance. But don't think just because you're not directly using insurance, you cannot get your money back. I personally would recommend using out-of-network or using providers that don't take insurance. Pay up front, but then be sure to get your super bill and use an app, call insurance directly, whatever you got to do, and get reimbursed. I would recommend that so you don't have to wait a long time. Make sure you guys get that checked and get the help that you need. It'll help you a lot with school. For example, if you're having trouble focusing on work or school or whatever, you definitely should be getting evaluated for something like ADHD. If you have ADHD, you can't just have the same workload and the same time do certain things as the person next to you. You need to understand that when you have a mental health issue or a mental health illness, there are actual changes in your brain and your behavior. It's not like you can just brush it off. You need to do something about it. That comes into my next point. My next tip is to use your school accommodations. I know it's a little harder for high school, but I promise you it is so worth going through that, 1 to 2 weeks of trouble to getting the paperwork or whatever you need, because they will have to accommodate you. Your school, all your teachers, all 8 periods. I don't know what the accommodations look like specifically for high school, but for college, they have a free accommodation office. Go in there, let them know that you're interested in setting up a meeting or wanting to know the process of how to get accommodations, right? If you go and you get that, remember we talked about that 1-year mental health check, okay? Let's say you're diagnosed with anxiety, right? I have seen people with anxiety get accommodations for extra test time, extension on their assignments, taking breaks during classes, being able to walk out the class when you're overwhelmed, take some time, come back as many times as you need. I've seen people being able to take tests in the accommodation office rather than taking it with the rest of the class. So you guys, use these accommodations. If you have ADHD, can you imagine how much easier tests would be for you if you had a time and a half, double time? Why are you taking a test in the normal amount of time, knowing that you literally cannot? Use your accommodations. So go get that diagnosis. Whatever accommodations you get, see what you can get out of it. See what kind of help the school is able to offer you, right? I promise you, just do it. Spend that 1 week going through that trouble, and it'll make your entire school year worth it. couple hours, an entire year of benefits, do it. My next tip is manage your time. Why are you walking around stressed? Don't do that to yourself. Stress is so bad for you. I think I might do a separate video on how to manage stress and how bad it is for your mental health and your physical health, right? And this was my biggest problem in college. I was always stressed for no reason. Don't be stressed. I promise you, you are going to get through whatever you're going through. But to make it a little bit easier, use Google Calendar. Anytime anyone comes to me with, Maryam, like, what did you do during college? What do you recommend? Like, how do you do this and this? Google Calendar. Like, I live by Google Calendar. I will say I kind of suck with, like, the notifications and stuff. Like, I will miss things, but it is so nice to have the time laid out. So, like, you don't have to jump in and just throw everything on your calendar, right? But when you're getting syllabuses, right, your syllabus week, put in everything. Look at that whole calendar they give you. They tell you at the date of every exam, every assignment due. Put it all in your calendar. Know what is happening when. But remember, it takes around 2 to 3 weeks to build a habit. Build that habit of using your calendar. Keep in mind, there's nothing wrong with self-care days. Like, if there's a day you're overwhelmed or whatever, like, just remind yourself to be nice to yourself, be kind to yourself, take the break you need and get right back into it, okay? Sleep. Please make sure you are sleeping. I used to pull all-nighters and still fail. How you pull an all-nighter and still fail? It's not worth it. Do your best, don't procrastinate, and get your sleep. It's actually, like, any test where I just studied the day before as much as I could and I just slept, I did better on those exams than when I would pull an all-nighter. Don't do that to yourself. It's so bad for you. I think that's all the advice I have.